So we're going to have a presentation on blood pressure, and we're going to look at a theme of blood pressure about how much control we can have over it. And to start with in the presentation, I'm going to look at some of the background science and medical terms, so that obviously when we start talking about controlling it, we can put it into perspective, looking at obviously what's widely available for the control of blood pressure. So first of all then, what is blood pressure? So we look at blood pressure. Blood pressure, it has two numbers associated with it. And as I say, for many of you may be very familiar with these terms and the numbers, but just to make sure we all have the same language when we're referring to them, there's one of the values is what's referred to as systolic blood pressure. It's the higher of the two numbers. And what systolic is, as you probably guessed from the word systolic, system, it's to do with the force that's required by the heart to pump blood around the body. So it's really to force the blood through your circulatory system. And that's called the systolic blood pressure. And it's the higher number of the two numbers that are used to record blood pressure. Diastolic is the lower number of the two, and that represents the resistance to blood flow of the blood vessels. So in other words, if you probably guess, when we're pumping blood around the body, first of all, we need sufficient to obviously you pump the blood through the vessels, and then obviously we need that extra pressure to pump it around the body. So we've got two numbers. Now, these two numbers are in fact pressures, they're blood pressures, and obviously they represent slightly different things, one to pump the blood around the body, and the other one, obviously, just blood flow through the vessels, the resistance. Now, these have measured in the term used and has been used for a couple of centuries now is millimeters of mercury. Their values are measured in millimeters of mercury. So we use the abbreviation mm for millimeters, and Hg is the chemical symbol for mercury. So you probably guess, rather than writing these words out in full, I would tend to use the abbreviation millimeters of mercury. And obviously there'd be one for systolic pressure and one for diastolic pressure. So, for example, if we look at a systolic of 120 millimeters of mercury and a diastolic of 80 millimeters of mercury, this is represented by probably a number that you may be familiar with and you may have heard of, that a ratio of 120 to 80, which sometimes is referred to as being a normal blood pressure. But what is a normal blood pressure? And that's another one. For example, what is a high blood pressure? And we're going to look, of course, what is a low blood pressure, because it can be either high or low. And if we look at the ranges that are used, we're going to be talking about really high blood pressure most of the time, and that's given a medical term, which is hypertension. And you probably realize, as much as there can be hypertension, there can be low pressure, which is called hypotension. It's words we use in medicine a lot, hyper being high, and in this case, high blood pressure. So medically it's referred to as hypertension, but a simpler term understanding what's going on is high blood pressure. Now, historically, this value through the decades has changed. And we could ask the question, well, why has it changed? Surely, it's been known for some time what is a safe blood pressure. So why should the definition or description high blood pressure actually have to be used? And why would it change over decades? And if we look at it historically, Back in the 1960s, when I learned first about pathology, and in fact, what I learned, and I still remember it, is that if we're defining in a patient that they've got high blood pressure, then they would need a value of greater than 100 plus the age of the individual. So obviously, if it's a 20-year-old, it will be 120. That's 100 plus 20, 120 over 100. This is back in the 1960s, as I say, when doctors were trained and we learned how to. Because one of the things that's characteristic about blood pressure is that blood pressure has to increase with age. Now you may say, why? And the reason why is because the blood vessels, the arteries, the veins of the body, they harden with aging, and that means we need a higher blood pressure to get them around. So it's not surprising back in the 60s, 1960s, there was this recognition that, yes, there's a background systolic, but we have to allow for age, and a convenient way to do that was simply add the age. So if we're talking about an 80-year-old in the 1960s, if they had a blood pressure of 100 plus 80, that's 180, over 100, they would still be deemed to be only borderline hypertensive. Now, you probably realize that's changed a great deal over recent decades. In 1980, for example, it was deemed that a high blood pressure would be, remember this little V on its side means greater than. That's greater than 160 over 100. So back in 1980, in medical schools, when they were learning about blood pressure, they would have learned greater than 160 over 100 is high blood pressure. Then in 1990, a more conservative approach, and the decision that in fact high blood pressure would be deemed to be greater than 140 over 90. And believe it or not, it's creeping down even lower and lower. Now you may be asking, but hang on, back in 1960, we actually recognized that because of the aging of the blood vessels, we would need a bit more pressure to pump the blood around the body. So therefore, where's this in this current data? In other words, why are we choosing such low values as being the threshold of which high blood pressure is deemed to be a characteristic? So you probably realize we've got in a situation now since 2015 of this magic number 120 over 80. And obviously for a 20-year-old, that's not a bad value to have. But obviously as we age, it's been more or less ignored, the fact that we do need this extra pressure to pump blood around the body because of the aging vessels. We'll come back to that a little bit later, but it's very interesting how this trend to drive down what is considered to be normal blood pressure and where the threshold is with high blood pressure. And there's some people that are skeptical of this drive of actually making everybody have a blood pressure of less than 120 over 80, saying, but what about this aging process that occurs and the need for a slightly higher blood pressure in the later years? So, yes, we get ourselves in a terrible dilemma here. What is high blood pressure? And even what is low blood pressure? Because a very low blood pressure, you've got a similar sort of problem in that if in the aging process we're not allowing for the extra pressure we need to pump it around. If we have very low blood pressure, then the danger is we won't have an adequate pressure to actually push the blood around the body. So there's lots of debate at the moment. What is the ideal? And they're settling on a range here between 90 and 120 for systolic, 60 to 80 for diastolic, or simply the magic number of 110 over 70 and aiming for that. But look at the difference that represents compared to what it's been 1960s, 70s, 80s, and even 1990. So there's also, as with diabetes, a pre-diabetic condition, pre-hypertension condition in the case of blood pressure. So there's a decision that, in fact, with pre-hypertension, this is where we're getting to values which are slightly higher than ideal, and is classified as pre-hypertension. And high blood pressure, if we're saying, well, where do you treat then? Where would you think about treating? It's usually in the range when it's greater than 140 over 90. There is a little bit of recognition, but only a little, that obviously for people that are 80 or older, because of the hardening of the arteries, yes, you have an allowance a little bit more systolic, but only 150. Remember, in the 1960s, we would have considered 180 being the threshold. And obviously, this means, as you probably guessed, because of this driving down of what is considered normal blood pressure, it's not surprising that so many people are on medication now for blood pressure. Because if you fix the numbers and say the numbers represent whether you're high blood pressure or not, then obviously the decision about medication is made for the lower levels. There are serious risks, though, from high blood pressure. Risk factors to the heart and the kidney, and for kidney disease, stroke, dementia, and diabetes. So yes, there are definite risks, but risks really, as we're saying, for clearly high blood pressure. Right, well, before we get so engrossed in high blood pressure, let's look at low blood pressure, because it does occur. And the reason why I'm emphasizing here that it does occur naturally. Some people naturally have low blood pressure. They're very much looked upon as being in such an advantageous condition, because as you probably guess, they won't need medication. It certainly wouldn't need any medication for high blood pressure. But with low blood pressure, the reason why it is becoming more concern is if there is over medication for high blood pressure, then some people will have low blood pressure as a result of that. So obviously it's important to look for, because obviously if someone was high blood pressure, has medication, but the medication is more assertive than it needs to be, then they could be low blood pressure, suffering from low blood pressure. Okay, I hope you can follow this. It's a bit convoluted, but let's just look at low blood pressure now. So where the systolic is less than 90 and where the diastolic is less than 60, that's referred to as hypotension. Remember, when we come on to talk about high blood pressure, we'll be talking about hypertension. So little difference in the spelling makes a lot of difference in terms of what we're talking about. So low blood pressure then, which is with those little v's on their side, meaning less than. So less than 90 systolic, less than 90 diastolic, and you get very definite symptoms. Symptoms of dizziness, lightheadedness, can feel sick, nausea, can have vision problems, blurred vision, weakness, confusion, and fainting. So some very unpleasant symptoms. And as I say, part of the concern there is I'm osteopathically trained, so I see patients, and when I see patients, I have to be careful of when they get up from being on a couch, from lying down, because lying down to standing up is a significant change in requirements for the heart. So you have to make sure that they come up carefully. And this is obviously applies if someone has hypotension, they may be dizzy when they get up from sitting in a chair. So, and the thing is, that's very important, because if you are dizzy or lightheaded, then do take your time standing up and do see a doctor about it, because obviously the problem with hypertension is if you are dizzy and you have a fall, then obviously that can be very serious in terms of possibly a fracture. So symptoms then of low blood pressure can be attributed in some cases with medication being excessive beyond what is needed. So suddenly standing up, suddenly changing position, and it's called postural hypertension. In other words, the blood pressure is fine for normal activities, but changing position can aggravate the symptoms, certainly the dizziness and the lightheadedness. Okay, so right, let's get on to talking about hypertension and causes of hypertension. There's a number of different causes. The first one is the most surprising, really. It's called essential hypertension. And essential, it occurs in over 90% of patients with high blood pressure. So those patients which have high blood pressure, 90% of them, over 90% of them, have what is called essential hypertension. And what that is we don't really know what's caused it. Right? We really are unsure of what has caused the hypertension. Isn't it surprising that over 90% of patients with high blood pressure, there's no particular reason? Now, the thing is, there can be a reason, as you probably guess, for the remaining 10% or so who do have high blood pressure. So we do need to check that those other reasons before we say, right, we're treating essential, we don't know what's caused it, but there are some of which we do know that there's a reason. One of them is if there's kidney disease. Glomerulonephritis is quite a word to say, glomerulonephritis. You probably might recognize the end of the word is itis, which means inflammation. And glomerulonephritis is obviously part of the kidney filtering device, and that gets inflamed, and because it gets inflamed, it doesn't do its job in filtering so well. There's a higher pressure, and that causes hypertension. So kidney disease, right, is one of the things we need to check for. If someone's got hypertension, just checking, obviously, from a blood test, it's quite easy to check the kidneys are doing their job and there's no disease with them. Another possible reason for hypertension is hormonal. Cushing's disease can occur, for example, naturally with the production of cortisol in the body, or it can actually occur because of steroid treatment. And again, that can give rise to hypertension. And the complication is if you're, say, on long-term steroids, then obviously, it can affect the blood pressure. So there may be need for medication or treatment of hypertension as well. So Cushing's disease, hormonal, is the reason for it, either cortisol or steroids, prednisolone, some other steroid that might be being used. There are, and we'll look at this in a little bit more detail because it's fascinating, nervous system. In other words, psychogenic. There is an element, as I said, even having, as we are innocently, hopefully, having a talk on hypertension, literally just talking about it can actually increase the values of it. Okay, so as I say, do remember to disconnect from the actual content and not actually personalize it. But basically, we know that some people are affected. Their nervous system means that automatically their blood pressures goes up, and it's called psychogenic. It's literally the power of the mind and the power of the nervous system. Now, there are some drugs, some medication, as we've mentioned with Cushing's disease already, that if you've got a chronic inflammatory condition, you may be taking steroids. If you are, then obviously what should be checked regularly is your blood pressure to make sure the steroids aren't producing an increase in blood pressure. Now, remember, as with all my talks, I like to emphasize that we're all different. Some people they can take steroid course and there'll be no discernible increase in blood pressure. Others can be very sensitive. Even cough syrups can actually cause an increase in blood pressure. Now, this NSAIDs, what is those? Those are non-steroidal anti-inflammatory drugs. So rather than write that out in full, these are things like aspirin, paracetamol, those sort of non-steroidal anti-inflammatories. They're painkillers and anti-inflammatories, and they can actually give rise in some individuals, not all, some individuals, hypertension. Cyclosporine, antibiotic, oral contraceptives, again, people that are going on oral contraceptives ought to have regular blood pressure tests. So it is important, though, to check before just saying, well, we don't know the cause, so let's just get on and treat it. It's very important that, first of all, kidney function's checked, hormone balance, nervous system, and to check is medication. Because obviously there might be a need to change medication with consultation with the GP if, in fact, it's found that particular drug type in that individual produces an increase in blood pressure. Now, linking with the nervous system is the recognition of what's called white coat hypertension. And that means literally, and you may have heard of a similar sort of studies which are carried out with placebo. That is, where you don't have the active ingredient, but the effect is purely because of the nature of the intervention. And with hypertension, unfortunately, it's in the less desirable way. That is that purely if you have your blood pressure taken by someone in a white coat, your blood pressure will be higher, right? And also if they're in a medical uniform, the studies have been done to show this, it's part of how powerful the mind is. And it really is quite a problem because obviously if you're going to a clinic to have your blood pressure measured and the value isn't a reflection of your normal blood pressure, but something caused by you going to the clinic or the office to have the blood pressure taken, then that presents a problem, isn't it? So, but anyway, so what is it? It's a persistent elevation of blood pressure that patients experience in the clinic or an office. And the prevalence, it's been widely studied, it ranges quite widely. Between 20 and 45% of patients suffer some level of white coat hypertension. It's more frequent in women and older patients and those with mild hypertension. So, very important groups there where the value may not be as valid as it should be in terms of, well, what is the normal blood pressure of the individual. So, yes, studies have shown that white coat high blood pressure gives rise to a slight increase in mortality. So, in other words, it's a hint that something's going on, but it shows itself over a longer period of time to actually have a physiological effect. And those people that suffer from white coat hypertension are likely to develop sustained hypertension. So there is something in it, but it's as if the mind is a step ahead and shows this sensitivity and gives rise to this white coat hypertension. And really what happens is very often is people that are got white coat hypertension is you assume that hypertension really does exist at some level, and it does mean that very often it's treated, but the way it should be treated is not with medication, because you want to save that if it turns out to be sustained hypertension. But what really is needed is obviously an approach to managing high blood pressure, which is something that the patient can get involved in, that the patient can actually contribute to. So that's very often treatments which are looking at lifestyle and diet changes. Now, you probably realize in the second half of this talk, we're going to spend much more time looking at, well, what do we mean by lifestyle changes and what sort of diet changes would really make a difference to high blood pressure. Okay, let's just check in there and see if we've got any questions at all. Okay, so we were looking at white coat hypertension. What I'd like to do now is just, again, just give us a bit more detail about the medication that's used to treat high blood pressure. Remember, in many cases, we're dealing with what's called essential hypertension. But if we look at the values that come from looking at blood pressure measurements, we find that, in fact, so many are within this category of what we call borderline to moderate. And there's quite a lot of realization. You probably guess the conversation we've just been had about, obviously, the way in which exercise can make such a difference to the values. That would be one area that we'd be focusing on. But you probably realize with so many people actually falling within borderline to moderate, there's really a lot of emphasis on realizing that there's things that we can do about borderline blood pressure, high blood pressure. So, but let's look at medication to see what's on offer. There are a number of types of actual drugs that can be used. Very often, the first line of medication would be diuretics. They're the ones that are sometimes referred to as water tablets. That is, ones that, if you're getting slightly swollen ankles or fluid retention, then thiazides are very often prescribed. Then we have medication that's referred to as beta blockers, right, which are involved. Their role, the way they work, is to block the breakdown of adrenaline, and adrenaline is something which obviously will tend to raise blood pressure. So it's beta blockers. Now the other names are quite complex: angiotensin converting enzyme inhibitors, ACE inhibitors, and the other type is calcium channel blockers. Now, if you know of anybody that's got high blood pressure that's having medication, it's likely to be one of those four types, and possibly really starting off in many cases with diuretics and then moving on to the other particular drugs. The thing about beta blockers, they're not getting such a good publicity as the other types. Right? Why is that? And that's because they don't seem to reduce cardiovascular mortality, and there does seem to be an increase in type 2 diabetes risk. So, and the increase in risk is 30%. So it's quite significant. So beta blockers there, although they're still quite popular, there is some reservation about them in terms of the mortality and developing type 2 diabetes. So a normal approach will be step one of using medication would be using diuretics. Step two would be either using ACE inhibitors or the calcium channel blockers, the CCB, as they're referred to. And that those should have fewer side effects using that approach. And obviously, different doctors will have different approaches, but basically, there is medication available. And as we're suggesting, looking at the way the values have changed historically, then a significant number of individuals are on medication. Now, what we're going to do now is step back a little, and in the stepping back, look at ways that we could actually influence our blood pressures in a positive way. And one of the ways, and one of the factors, we've mentioned already this psychogenic, this power of the mind, and we see that in the white coat syndrome, where simply just wearing a white coat or a medical uniform means the blood pressure high. You probably realize that's part of the spectrum of stress. So there is a role of stress in high blood pressure. So it can be a causative factor, but normally it's this individual response we have to the stress. So a stressor for one person may not be a stressor for another. So the surprising situation is that it's almost that we almost have personal stressors that will tend to mean that our blood pressure will rise. So it's rather than the stress itself, it's the way that we respond to it and the way that we process it. So if we're looking at what could we do about now, obviously, it would be wonderful if we could all go back on a squash court and get our exercise from that, but if only. But let's see what we've got that's available. Now, there's things that can be relatively easy to do. One of them is deep breathing exercises. That is, deep breathing is where you engage the diaphragm. So you breathe in deeply, your diaphragm goes down, and your abdomen goes up, and then you breathe out. And obviously, the reverse occurs to your diaphragm and to your abdomen. Deep breathing exercises, obviously, slow deep breathing exercises, and wherever possible, making the breathing out, the exhale, longer than the breathing in. And it works. It engages the parasympathetic part of the autonomic nervous system, which is the physiology of explaining if you breathe deeply, it will introduce calmness and it will reduce your blood pressure. And obviously, if that's used quite routinely, then obviously the effect lasts beyond just the breathing exercises. And you probably guess meditation, for example, mindfulness meditation, where we might focus on our breathing during the meditation. So we breathe, actually scanning for different parts of the body at a time, and that can be effective. There have been medical studies to prove the effectiveness of mindfulness meditation on stress levels, on stress hormones, and on blood pressure. Yoga, again, because there's a lot of thinking, focus that goes on in yoga, and that, because it's linking the mind and the body, that also has an effect on blood pressure. You may have heard of Tai Chi and Qigong. We'll look at this again a little bit later. Tai Chi and Qigong, again, research has been carried out and shown the effectiveness in helping to reduce blood pressure. Progressive muscle relaxation, a bit like body scanning, where you scan an area, tense it and relax. Scanning through the body. Another one is hypnosis. So these are very often, if someone has particularly borderline moderate blood pressure, hypertension, then these are very often included, because again, remember, from one individual to another, our responses are so different. So of course, by actually having these relaxation methods, it can contribute. In other words, it's not a magic bullet. It's not going to just simply by that one process, but many of these things are contributory. In other words, they will contribute to giving us more control on the blood pressure, and relaxation methods are always incorporated. One which is a very significant, in some of my previous talks, I've mentioned how potent Epsom salt baths can be. Epsom salts, magnesium sulfate, the actual salt actually in a warm bath, particularly obviously with the warm bath, helps to draw the blood to the muscles away from the central area. You do have to be careful, because the drop in the blood pressure can mean that if you get out quickly from an Epsom salt bath, you might feel dizzy. But basically, it's a very effective way, particularly at night, because a warm bath and then getting into a cooler area for sleeping, that drop in temperature helps to engage sleep. So again, it's an area that's well researched for its effectiveness. So reducing stress is important when we're thinking about getting more engaged with our blood pressure to make sure that we can, of course, avoid being moderately hypertensive. Now, before I get in any detail at all, you probably realize we have to mention exercise, because exercise is so effective in giving us a long-term change. And if we're talking about regular exercise, yes, the research is there that regular exercise is effective at, now the arrow pointing down is reducing, so it reduces high blood pressure. So the research is there. Walking, swimming, cycling, that very clear exercise method. It could be a static bike that we might be using in cycling. Walking, remember, we can adjust the pace. If we have the advantage of not only having a horizontal area for a level area for walking, but we might have some hills, then obviously that can be, again, a great advantage to have in helping. And you probably realize in most cases we will individually manage the exercise to fit ourselves in terms of our own health at the time we commence the exercises. But it's worth remembering, as much as obviously, circumstances may be that you can't go for long walks, or swimming's difficult to organise, or cycling's out the question, possibly because of problems with knees. But basically, just a reminder that non-exercise activity is also effective. Again, research has shown that people that are just naturally active, that are always up and about, a bit of a fidget, living in a house where there's stairs, or stairs, it's a free exercise machine. You're having stairs, going up and down stairs, part of what we call non-exercise activity, but can make a lot of contribution, obviously, to managing blood pressure. Now, this is the moderate. Now, I'm aware that obviously any of you that might look at exercise regimes and personal planning around exercise, but here looking at what the research has shown as the most modest quantity of exercise. So mild to moderate exercise for greater than 30 minutes, 3 times a week, and it's controlled. So people have carried out studies with that amount of exercise and found that you get 5 to 10 millimeters of mercury in both systolic and diastolic, a reduction in both those two. And that could be enough to turn borderline or mild blood pressure into normal. Because remember, these levels, when we get so focused on the numbers, that obviously, reducing a number by 10 or more can in fact simply move us from actually having mild high blood pressure back into being normal. So exercise there, and obviously if you were to do more assertive exercising, then obviously the advantages would be greater. Now, I've mentioned Tai Chi, and the reason I wanted to mention it again is that there's some research that's been carried out on it, because it's one thing to make the claim, it's another one to actually have documentary research evidence to say, well, does it really make a difference? So rather than just, well, people feel their blood pressure has reduced from Tai Chi, there's been research studies to actually measure it. So it's a very gentle exercise. It's slow, flowing movements, sometimes referred to as meditation in motion. So it is a very gentle exercise. And as I say, it's more than just the movement. There's a flowing movement, and there's a mind-body link, a meditation of thinking and connecting with the body during it. And the research was carried out on 4 one-hour sessions a week of Tai Chi or aerobic exercise for a year. And it found that the Tai Chi group, right, actually there was a reduction in systolic of 7 millimeters. You probably guess it was carried out for quite a large group, and there is systolic. And for looking at aerobic, there was a reduction of 4.5 millimeters for the aerobic. And the thing about the Tai Chi was it seemed to be a long-term change. So you probably guess we could say, well, that's a bit of an advert for Tai Chi, because not only is it reducing the systolic blood pressure, but it seems to be doing it long-term, which is very valuable. The idea that even if you miss periods of doing the exercises, or you do it for a period of time and then circumstances change, you can't do it any longer, there does seem to be a long-term change. So quite interesting data there to show the differences that we get between something, a very gentle exercise, and obviously something more assertive. So, but the other thing, selling Tai Chi a little bit more than just saying it can obviously affect blood pressure. It obviously, at the same time, because it's a flowing movement, because it's a movement where you're moving your body and there's elements of balance in it, it's very good in terms of ensuring flexibility, balance, gait, which is the way we walk, relaxation, breath control, and it's even been shown to be beneficial for sleep. So they're quite interestingly, something like Tai Chi Qigong is different, but again, has similar sort of effects in terms of flexibility, balance, relaxation, and breath control. So just an area there, just to say it doesn't have to be intensive exercise, that we can do very gentle things and they can make a difference. And remember what we said about non-exercise activity, just being someone that keeps on the go, keeps busy, can make all the difference to blood pressure control. Right, now you probably realize diet creeps in terms of having an effect on the body. And obviously as diet, what we are what we eat. Remember, it is a term so frequently used that obviously diet does have an effect, and it can have an effect on blood pressure, things we eat. And of course, if we're looking at a general guidance, what would we look for? We would look to normalize body weight. Now, I don't know if you've heard the term BMI, body mass index. It used to be recognized as being a way of measuring how overweight, normal weight, or obese, or very obese that an individual is. It gives us a number to work with. But there's some questioning about BMI now, because BMI doesn't really reflect where the actual fatty tissue is. So now more researchers in this field are saying, well, BMI used to be good, but it's not as good as something like waist to height measurement, where the waist is the important area of the body where you want to avoid the accumulation of fatty tissue. So a waist to height ratio is a better measure. But anyway, research is still going on, but until recently, BMI has been a good measure. So what we try to do is normalize body weight, try to get the BMI down to the range of 20 to 25 if we can. And in many cases, obviously using plant foods. So the idea is to, of course, reduce body weight and try to move towards plant foods, as because the effect that they have in reducing blood pressure. And I've made a list there. Now, remember, you will get a copy of this handout. So it actually will be listed for you there. I had to put celery in because it's seen in the case of blood pressure to produce significant changes or reductions in blood pressure. Can I remind you something I mentioned earlier, that we are all individuals with our own unique metabolism. My background is in biochemistry, so I can say that, yes, despite learning my metabolic pathways, you have to realize that when you're working with patients in a clinic, their metabolisms can be different. So celery for some people can be almost a magic food ingredient for reducing blood pressure. Others, it doesn't have such a significant effect. Now, garlic, onions, and leeks, they certainly nutritionally they are part of a family. And as we see, garlic is used by not only people advising on diet, but also medical herbalists, because they use garlic as a herbal intervention. But garlic, onions, and leeks very often have beneficial effects on blood pressure. Fermented foods is something, unfortunately, in society we have less of now. So it does mean that certainly in many countries, fermented foods are a rarity, but in others, as you probably guessed, in Eastern Europe, in Germany, sauerkraut, fermented foods are a much more common component. Then there's this whole thing of probiotics. Now, you may already have realised that beetroot is looked upon as being, for people that have high blood pressure, be advantageous to have in the diet. And very often when making juices up, putting some beetroot into the juice, that has a beneficial effect. And it's because of the production of NO, which is nitric oxide, and nitric oxide actually is known to dilate, which means relax the blood vessels. And that obviously relaxing the blood vessels means that the blood pressure will drop. So brassicas are a cabbage family group. They also have a beneficial effect. Nuts, and particularly walnuts, they get a mention specifically, but nuts are good, and the seeds. And that's because of EFAs, which are what are called essential fatty acids. I will come back to talking about them, but EFAs, essential fatty acids in seeds and nuts, are beneficial. Green leafy vegetables, whole grains, and vitamin C rich foods, citrus fruits, broccoli. So really what we call good diet advice. Changing the emphasis to plant foods has a benefit. There's been studies on veganism, on vegetarianism, and certainly not being exclusive and saying, well, you don't eat meat, but obviously changing the focus of the diet can be beneficial for blood pressure. One thing that so often is mentioned in terms of a way that we could have an effect is looking at potassium and sodium importance. Now, before I do that, mustn't get too carried away with pushing on through the presentation. Can I just check with you at any stage, any questions you might have had of what I've covered so far? Potassium and sodium, we're going to be talking about their importance in controlling blood pressure. So with potassium and sodium, we're really looking at two minerals. Now, you probably realize salt, sometimes referred to as common salt, is sodium chloride. But there is another salt which is very important, which helps with blood pressure, which is potassium. And what very often is wrong is the ratio, the relative amount of sodium to potassium. Not that we have to exclude sodium completely, but what is happening in our society, in our food industry, is too much sodium and not enough potassium. Whereas in nature, say, for example, in plant foods, that's why the avocado question is such a good one, is that with plant material, you're really talking about normally the potassium level being so much higher than the sodium. So let's look at this, because it is quite a significant factor and it does make a difference. And the realization that, remember that we're all different, our metabolism, as much as we have common metabolic pathways, the way those pathways are used varies from every one of us. If we have a diet that's high in sodium and low in potassium, these characterize what we call a high blood pressure diet. So if, say, for example, if we're cooking at home and we sprinkle a lot of salt into the whatever we're preparing, then obviously that added salt can have an effect on blood pressure. But we need to realize that not everyone is salt sensitive. It's a bit like cholesterol. You know that sometimes there's, oh no, don't have a high cholesterol food. But for some people, they're completely immune. It doesn't matter how many eggs they consume or how much saturated fat they consume, it doesn't affect their cholesterol levels. I mean, there is that realization. And the same with salt. There are salt sensitive, SSIs, individuals that are sensitive to salt. So if you give them sodium, their blood pressure goes up significantly very quickly. Now, about 50% of people with high blood pressure are salt sensitive individuals. The normal level is only 25%. So if you take the population as a whole, then normally there's only 25% which are salt sensitive. But if you've already got high blood pressure, you're likely to be, it's about 50%, you're salt sensitive. So that means if we were to control or actually reduce the amount of salt in our diets, it would actually affect our blood pressure significantly. Now, normally in the UK, and I avoided talking about North America, but in the UK currently, but remember our diet is under change and influence from North America, but basically currently about 5% of sodium in our diet is simply from the materials that we're using. The other 95% comes in the preparation and in the cooking. Now, obviously, that's an area that we can actually have good control of if we prepare our own food and cook our own food. But if we buy in prepared meals, then of course, we don't have control over the sodium intake. And that may obviously be a cause of high blood pressure. Now, if we look at really what happens in most Western diets, the ratio is potassium to sodium of 1 to 2. So there's twice as much sodium as there is potassium. But it's considered that a healthy diet should be the other way around, not 1 to 2, but 5 to 1. In other words, 5 times more potassium than sodium. Whereas our diets, on average, are 1 to 2 in the opposite direction. Now, fortunately, vegetables and fruit have potassium to sodium levels of as much as 50 to 1 or even greater than 50 to 1. So can you see, if you wanted to be able to start saying, well, look, I know I've got threshold of pre-hypertensive, what contribution could I make? And one of them is looking at the ratio of potassium to sodium. In other words, trying to reduce the amount of sodium we put in our diets and wherever possible, adding potassium. So if we're looking at the limit, the best limit to have is keeping our sodium down to less than, remember that V on its side means less than 6 grams per day. And we might need, unless we're naturally on a high plant food diet, we might need obviously a supplement of potassium. Potassium is potassium citrate, is a good form to have, and something like 2.5 grams. That, believe it or not, is equivalent to 4 bananas. Now, that's a lot of bananas to consume in a day. And as good as bananas are as a source of potassium, it wouldn't be wise to consume that. But that's the sort of level that obviously, though, we can get nearer to that level of input of potassium by, of course, eating more vegetable and fruit in our diets. We do have to be careful about kidney disease and medication if we do actually consider a potassium supplement. But otherwise, obviously, that slight change, increasing the amount of potassium, can be advantageous. Now, there are supplements that we can actually, these are things that if somebody says, right, well, look, and that happens sometimes, patient presents and say, look, I'm pre-hypertensive, what can I do? Then obviously what we've considered around exercise, what we've considered in terms of particular foods, and obviously what we've considered in terms of potassium to sodium ratio. But there are more immediate effects because some patients saying, well, look, okay, I'll change my diet, but it's going to take me a bit of time getting used to it. Is there something I can do before that? And if that's where you might say, well, supplements have the advantage because you can take the supplement while you're fine tuning your diet to get the beneficial effect from diet, which is the best way of obviously obtaining these changes. So yes, you could, in fact, increase potassium by taking potassium citrate, but other things that we could take. And I put the values here in most, not in all, but where there's been a research study and where it's been shown to reduce. Omega-3, now remember, omega-3 is a chemical way of saying that there's a particular chemical group, 3 carbons in that particular structure. But you may have heard the general term omega-3. It just refers to particular types of oils, either fish oil or it can be linseed oil, either of those. And it produces a very, very small, that, as you probably guess, even taking that over a long period of time, you're only going to get a couple of millimeters of mercury systolic and 1.5 diastolic. You know, people still say, right, look, okay, I'll increase my fish intake or take fish oil supplements just as part of a regime. It does contribute, but it's very small. However, if we take out a particular component of flaxseed oil or fish oils, which is called dicosahexaenoic acid, again, very particular chemical structure, it's a naturally occurring acid in oils. And if you have between 200 and 500 milligrams of DHA per day, it produces an average. And as you can probably guess, that is much more significant. A systolic reduction of 10, diastolic of minus 10. So those are obviously a benefit. So DHA, which is available in health shops, or by increasing your flaxseed, hemp oil, or fish oil, can give quite significant changes. So some supplements, there is a clear track record. Now, one which, again, just reminding you about how individuals respond differently to different supplements, right? Remember that these figures, which look so precise here, minus 10, minus 10, remember in the study there would have been a range, some hardly benefited and some getting even more significant changes. Coenzyme Q, it's a bit like saying with any supplementation, it's if we've got a deficiency, then we're going to feel the benefit. If we don't have a deficiency, we're not likely to get much benefit from that particular supplement. And that applies coenzyme Q10. Those of you may know of it because it's sometimes taken by athletes, because coenzyme Q is part of the energy production in the body, without going into a lot of detail, but it's there to make energy. But coenzyme Q10 does have an effect in some individuals, about 40% of those with high blood pressure, It's not a magic bullet. It takes time for the body to adjust and to benefit. But 100 milligrams per day for 10 weeks produced quite significant effect in those that responded. So in other words, their body already had some sort of deficiency. They weren't making enough coenzyme Q10. And in those 40%, that they were quite significant. And not only did the blood pressure decrease, but you could measure the change in the vessel's resistance. The vascular resistance decreased as well. So some supplements there, DHA and coenzyme Q10, in some individuals made quite significant contributions. Now, another component that made quite significant contribution is vitamin D. Vitamin D3, as it is, the active form of the vitamin, and levels of about 1,000, possibly 2,000 in IU, remember, means international units, about 1,000, 2,000 units, international units per day. And that over a long period of time seemed to reduce artery stiffness. Do you remember what I said at the beginning? That the reason why, as we age, our blood pressure goes up, even though at the moment there's this fixation that everybody should have 120/80, irrespective of their age and their health. Remember that arteries stiffen, and obviously vitamin D3 seems to be beneficial in many people for reducing artery stiffness. Now, just to mention though, with vitamin D3, it's like many vitamins, but particularly vitamin D3, which is a fat-soluble vitamin. So we do need to be careful about taking very heavy doses of it because it can accumulate in bodies and is to some extent toxic at very high doses. But the other thing is that vitamin D3 ought to be consumed at the same time with vitamin K, vitamin K2. Why? Because vitamin K2 ensures that the vitamin D has an effect on calcium absorption. If we take vitamin K2, it makes sure that the calcium goes to the bones, not to the blood vessels, because we don't want the extra calcium to come into the body because of the vitamin D3 and then just be deposited into the vessels. We wanted it to be directed to the bones, and that calcium would be if we have plenty of vitamin K2, either from leafy green vegetables or from a supplement level. So those are supplements. So I'm giving you a little bit of insight here. Nutritional therapists would, if they're working with people with borderline hypertension, they would say, look, there's various supplements that we could take initially so that as we work on diet, then we can obviously get a more permanent change for obviously controlling blood pressure. Right, well, as much as they're nutritional therapists, there's medical herbalists, and there are some particular herbs which have got a good track record. The first one, hawthorn berries, 500 to 1,000 milligrams per day. Yes, research studies have shown it reduces blood pressure. It's mild, and it normally takes 2 to 4 weeks. So it's slow acting. If we're changing blood pressure, you probably guess what we're really working on is probably hardening of the arteries. That is not going to come overnight as a change. We're really going to take weeks to get those vessels to return to their normal or more flexible form. But hawthorn berries, some medical herbalists would in fact suggest to reduce blood pressure. Now, I've mentioned already, and it's a bit of a contest on whether it's a food supplement or whether it's in fact a medical herb, is garlic, right? So garlic in whatever form, whatever type of garlic, and if you take 4 grams of fresh garlic per day, and the research has shown after 1 to 3 months, again, you get quite, remember these levels of -10 for systolic, -5 for diastolic, it wouldn't take more than a couple of those to very often take someone that's borderline hypertensive back into being normal. We do need to mention with garlic that garlic being an anticoagulant, you need to be careful about, obviously, if you're taking an anticoagulant medication. So remember, even herbs you need to treat with respect, and obviously be aware that there can be complications with them if you're pursuing a particular dose of something. So another component which has been found to reduce blood pressure, which is a herb, is olive leaf. Garlic and olive leaves have also got good reputations in terms of boosting the immune system. So, herbs do have very often more than one property and more advantage. Olive leaf here, 4 milligrams 3 times a day for 12 weeks. Now, remember, all these details and these numbers are available on the handout, because obviously if you were to contemplate actually thinking about any supplementation, remember the wisest thing is always have a consultation and make sure your doctor is aware of any proposals you're thinking of changing significant in terms of your diet. There is a tea which is effective at reducing blood pressure, and that's hibiscus, sometimes referred to sour tea. And you probably realise the reason it's called sour tea is because it's quite sour, which is I find an interesting taste to have, rather than everything being sweet. To actually have something that is the other direction, which is sour. But hibiscus does have an effect on reducing blood pressure. So you probably guess what we've done in this talk is really we're looking at this 80% of the population. So obviously if the blood pressure really is very high, in the 160s, 180s, 200 systolic, 90, 100, 110 diastolic, then obviously that very often will require a more immediate intervention, because obviously the hazards of high blood pressure. But if we're talking about 80% of the people with essential hypertension, that's quite a large proportion of the population there that have blood pressure diagnosed as being hypertensive. They're essentially mild hypertensives. Now, if it's mild, what can we do? So we're really talking about certainly where it's 140 to 160 or 90 to 104. So, what would be classed as the trouble if we use the label hypertensive or high blood pressure, we need to be more specific. And then as we were exploring there, the values vary so much depending upon when you take them and obviously what's happened before and after in terms of, for example, white coat syndrome. So let's say first thing to think about is reducing excessive weight, right? So anything that can be done to look at the diet to reduce weight will obviously benefit blood pressure, because obviously if you've got more weight, you've got more body to pump the blood around. That's going to require more effort for the heart and therefore obviously a higher pressure. So excessive weight, because of the additional part for the body to work with, it means that obviously blood pressure will be high. So anything we can do to reduce excessive weight is beneficial. Healthy lifestyle generally, we've mentioned about exercise, how invaluable exercise is. And remember, exercise, whatever you can do, whatever it is, even if it's just finding extra jobs to do around the house, keeping active is so valuable. And with the exercise, thinking about stress reduction. So any of the techniques that I listed, explore, obviously trying to introduce those into your daily routines. Avoid smoking, and of course, most vapes have nicotine in them, which is vasoconstrictive, which means your blood pressure is going to go up. So smoking and vaping really are not good news if you're mildly hypertensive. Caffeine, can I mention again, the individual variation that you get with caffeine. But basically, if you're mildly hypertensive, it's best to think of reducing. That doesn't mean excluding completely, but obviously reducing would be a good idea, as obviously alcohol is as well. Just adopting a healthier lifestyle. We've mentioned the salt and potassium balance in the diet and how important. So you don't have to think purely of the 4 bananas. That just gives you some idea that we need to think about the fruit and veg component, because that will really help to rebalance that ratio of more potassium than salt. Fiber helps. Refined sugar, remember the sweet sugars that we have, sucrose, glucose, refined sugars, trying to reduce those especially, but particularly fructose, which is the fructose is the sugar which is now more often used in processed food. It's cheap, it's very good at its job because it's so sweet, but the body doesn't process it very well. It does actually produce a problem in terms of build-up of fat in the body. So trying to avoid ultra-processed food is a great advantage, particularly for anything that is slightly sweet. Specific foods, we listed those: celery, onions, garlic, leeks, all good news. But the list there to give you some ideas of which specific foods are particularly helpful. Then there's supplementation. Vitamin C, quite high doses, 3 times a day. Vitamin E, vitamin D3 we've mentioned. Magnesium is beneficial as well. And omega-3, flaxseed oil, or even DHA if we wanted to really ensure a maximal response. And that is considered to be a recipe for getting mild hypertension back into normal within 6 months. So pursuing those guidelines about lifestyle, diet, supplementation, you should get a return to normal within 6 weeks. So, blood pressure, it is possible to contribute to controlling it.